Are you in pain, but nobody can tell you exactly why? X-rays, MRIs, CAT scans, and blood work are okay or inconclusive, and so you're told it's psychological. Sound familiar? If so, watch this video and learn all there is to know. I'm Liebscher Bracht, and I'm going to explain the relationship between your psyche and pain. Lots of patients tell me, patients who are in pain, that no cause can be found. No herniated discs, no signs of arthrosis. Well, the situation simply is the following. People are in pain, chronic pain, some of them for years, and nobody can find anything to explain that. And if you are among those people, you know how difficult this situation is. And if not, I guess you can sympathize. Something is torturing you, and you're told, sorry, there's nothing wrong with you. Everything is okay. And as I told you before, and there is nothing we can do to help you. Maybe you should have it checked out. Maybe it's psychosomatic, and psychosomatic pain is often associated with anxiety or fear, too much work, depression, stress, these kind of issues, but all of that is not very tangible. And now imagine you're in such a situation and you're told it's all in your head. That's what people often say, it's all in your head. But where's the approach? And if you inquire further and want to know how exactly these things are connected, you're often given 5 different explanations from 5 different people because nobody can really explain to you how your psyche, in a real way, causes pain. And that again brings me to an idea what you could do about this pain. Experience has taught us that physical activity alleviates physical pain. So what's the deal with that? I'm about to tell you a story that happened to me, a story I'll probably never forget. It happened during one of my training sessions. So we start the day, and I often have a lot of therapists, physicians, who bring their own pain issues into the session. And there was this physical therapist who suffered from neck pain for 10 years, a chronic case, apparently beyond any help. And on the last day of the training course, when I normally take away, or at least try to, pain that still persists, I briefly treat him, and I realize right away his neck was rock hard. You know this feeling, if you're doctors or therapists, from your patients. I start to apply our osteopressure technique, this manual pressing of certain points, when suddenly I can feel how he's getting nervous. And I'm familiar with this kind of defensive reaction, so I go easy on him and ask him what's the matter. And he says, I have to step out for a minute. So he leaves the session, goes outdoors, it's summer, and I continued with my job. And sometime later, he comes back, standing in the far corner of the room, and he yells, Roland. And I'm thinking, oh my God, what's going on here? And then we start talking, and I could see he's been crying. He says to me, I've been out there crying for an hour, and now I'm going to tell you what happened to me. And this is the story. 10 years ago, he was driving his car with his 2 kids in the back, a boy and a girl, on the highway in Austria, went into a tunnel, out of a tunnel, and at some point, a total blackout. And the last thing he remembered was the setting sun blinding him as he came out of the tunnel. And the next thing he remembered was sitting in his car in totally different surroundings. The children are screaming, and a helicopter is landing. What happened? With his 2 kids in the car, he went off the highway, plunging 70 meters down. Thank God he survived. But this experience was still in him, literally. And he tells me that for 10 years he has had no memory of that event. He knows, theoretically, that he was in his car, he plunged and crashed, but why and how, he simply could not remember. And during the time he was outside the session room, he had one crying fit after the other. He felt guilty because of his children. And for the first time, after 10 years, he re-experienced what had happened back then. He came out of the tunnel, and there was some road work with hard-to-read signs posted, and he got confused, and then he inadvertently hit a guide rail that slopes upwards, sticking out from the road top. And so the front of his car took off, making it impossible to steer or brake, since 90% of the braking power is applied to the front wheels, not the rear wheels. And then he flew off the roadside, knowing that they were about to drop to their death, him and his children, and then they hit the ground. The car, of course, was a total wreck, and the fact that they had survived is a miracle. Okay, this person joins my training 10 years later, having suffered from a chronically super stiff neck with chronic pain all the time, and I start to treat him, and that is the result. The entire course was fascinated by the story. Me too. And at one point, somebody asks how his neck is. It hasn't occurred to anybody to ask. And he touches his neck, moving his head around, saying, "My neck pain is almost gone. It's maybe down to 20% of what it was before." Thank God, the kids were all right. Nothing really bad happened to them. The girl had a cracked cervical vertebra, and the son a broken arm. But all things considered, it could have been much worse. But that was his main issue, his main problem. For 10 years, he'd had this guilty feeling because he had almost killed his kids. And he talked about this, that this was an ongoing issue. So what happened here? He had neck pain with immense tension. I released that tension, and that was the reaction. I'd known this from other cases where, during a therapy session, people start to cry. I mean, real crying fits. And that made me realize that there were a lot of emotions rolling inside of them, something we worked on. Nowadays, we assume, and a lot of psychotherapists agree and use this as a model, that the moment severe traumas happen and your psyche has a hard time dealing with them in your daily life, traumatic losses, for example, if one parent dies and the other has to take care of the kids, and your spouse has died, and that makes everyday activities difficult. And so it makes sense that your psyche pushes these tensions out of your consciousness and into the subconsciousness, into the body, and all that in the form of small muscular tensions. And according to this model, you can regard your body as an external storage room for your psyche, where you transfer all the negative energies so that you could live your normal daily life. But these tensions are still inside your body. And these little tensions, they remain. And if you don't release them in some way, and please don't forget, this tension is added to all the other tension that results from our lack of movement, which, as we know, causes pain. And now imagine this pain, created by your limited movements in your daily life, resulting in pain all over your body, more or less. And this is compounded by these tensions from your psyche and the emotional pain they cause, intensifying the pain you already have, or giving you the pain in the first place. But that would mean everybody would have to go to a psychotherapist to deal with these tensions, to somehow release them. But I say, no. We don't need that, since everybody already has a built-in psychotherapist living inside of them. What does that mean, a built-in psychotherapist? Basically, it's our 100% flexibility. What we say is, everybody has a certain skeletal flexibility of 100%. Unfortunately, we only use 10% of that. What does that mean? Well, if you have these kind of emotional tensions moving from your psyche into your muscles, they reside in specific muscles. And with certain movements, you want to reach something specific, you want to rotate, you want to do different movements. But at that moment, your muscles pull on these tensions because you're doing that movement. And that's how it works. Again and again, you try to move and there's some resistance. Maybe it hurts or your body realizes it can't reach that far, but it tries anyways. It's kind of a training, and your psyche dials back the tensions in your muscles to correspond to the necessity of the movement. What you have to know, and this is our experience, is that your body can only let go of tensions your psyche knows how to deal with, because this energy, The law of energy conservation says energy cannot disappear, it can only be transformed. This energy is in there, in your body, and if you release it from your body, your consciousness experiences the events again, relives it. And that is what we clearly saw in this story I told you earlier. He was crying. He relived the entire event, everything that happened, because the tensions that were released triggered a re-experiencing of the traumatic event, and then it was erased, finally dealt with for good. The sad thing is that some people carry this emotional baggage with them their whole lives, baggage that becomes even heavier over time, and finally is buried with them without ever leaving them. And that is one of the reasons I asked you to please share this video, because too many people suffer. And we want to put an end to suffering, be it pain in your body or pain caused by emotional trauma. So please share this video with as many people as possible so that everybody learns about these relationships, so that many more people have the chance to address their pain. In particular, pain that at first glance seems to have no discernible cause. And that brings us to the reality of our pain therapy. I mentioned earlier that it happens quite frequently that patients start to cry and are puzzled as to why they're crying because it doesn't hurt that much. And I tell them and explain to them how these things are connected. And as soon as they understand, I ask them if they want to continue. They want to get rid of that baggage. And most of them say yes. And the best part is, you don't have to investigate what kind of events they've experienced. Early childhood events and such. All that is a topic of its own. And we don't have to focus on that because we release all of that, no matter what. And then it's out. And I always recommend to therapists and the doctors that I train who have no experience with these things, they should collaborate with psychotherapists, with psychologists, and refer their patients to a conversation therapy to digest all that on a mental and an emotional level. What I see, and a lot of our therapists also, is how relieved people are afterwards with all their pain gone, which is a great part of that relief, but also the other elements, the emotional, mental part of it, everything. I mean, even their facial expressions change. But that's no wonder. If you have to deal with such an emotional whopper inside of you and that issue suddenly dissolves, then that's a tremendous change that is felt as something positive. And so you could say that pain therapy, as an unintended side effect, is also psychotherapy, at least the beginning of one, or an additional one. I myself stumbled upon this issue, this topic, because I had psychotherapists in my training sessions, and I asked them, why are you here? I mean, you work on a different level. And they surprised me by saying, Roland, we have patients, and we have to open up these patients so they can address their issues, which are often hidden under thick layers, so that these problems are laid bare. They talk about cracking, prying open the patients, but in a positive way. You have to pry your patients open so everything can be released, and you can apply your conversation therapy to help them deal with this. And they told me they've had the experience. If they approach the problem with our osteopressure technique, the manual therapy, they can see an effect after 3 weeks. But if they do not use this manual therapy, it takes 3 months to show any results. So it speeds things up, and they really appreciate that since it makes it easier for them to help their patients. And at the same time, it is true that patients who have emotional problems are often in pain. Patients with depression, for example, in this context, are often in pain, and that is a connection already described by Wilhelm Reich with his so-called muscular armor. Wilhelm Reich was a psychoanalyst and a psychiatrist and found out that most people who have emotional problems often also suffer from severe tensions. And he was one of the first to describe that phenomenon, meaning that negative emotional events, traumas, can cause tensions. And that brings us full circle back to the question I initially asked, how does your psyche cause pain? And now we're at that point, because I'm not sure if you know our lake of pain metaphor. where we have been able to prove over the last 30 years that pain basically is something that can reach a level of intensity that your body has to respond to prevent damages, avoid herniated discs, arthrosis, and so on. And that's exactly the reason why our brain transmits signal pain to our body to prevent such damage. Our body wants to keep us from moving around in these situations. And if you think that's kind of a paradox, well, it is actually, because we actually don't move around enough. Then subscribe to our channel, since I'm going to produce a special video on this, as it's rather a big topic. And something interesting can be derived from all these connections that we've been talking about. We know that people who are active and do a lot of sports are in a better mood. And that, for example, having depression and being physically active normally does not go together. And that's why we encourage people with depressive moods to become physically active to exercise, because that can help to alleviate these depressive states or make them disappear for good. To sum up, if you have pain that cannot really be explained, then you are told this is emotional pain, psychosomatic pain. Then, from now on, interpret it like this. Well, I have tensions in my body caused by my emotional state, my psyche. So, we say, do our exercises, have therapy, release these tensions, and you can surely see not only this pain disappear, but also the underlying emotional and mental trauma can be alleviated or go away for good. As I said before, please share this video because of all these connections. You wouldn't believe how many people have to struggle with these conditions without knowing anything about them. So please forward this video so that these misconceptions can be cleared up. It's all about moving in as many forms as possible. So I'd like to invite you all to check out more of our videos because they give you the opportunity to move your body in a very versatile way with targeted exercises for your entire body. You can do them once a week or every day. Just click up here to find out more. I'm sure you'll love it. Bye.